Hello, my name is Raven Rather, and today I will be demonstrating the proper administration of an intramuscular injection. So first you need to gather your equipment. I have a 22 gauge, 1.5, 3 milliliter syringe and needle, which is the correct size for an IM injection. I have an alcohol swab, a gauze pad, and some gloves. So first you need to go to the medication administration cart and see what type of medication is to be administered. So for the patient Jane Doe, birth date 3/27/1989, there is a bacteriostatic ordered at 9 milligrams intramuscularly at 1100 hours. It is the correct time, so I will remove the medication from the medication cart and check it with the MAR. I have a bacteriostatic, and it is 9 milligrams per milliliter. And the expiration date is December 1st, 2015, so it is not expired. To do my calculation, I need to get 9 milligrams, and my medication says is 9 milligrams per milliliter, so I will be giving 1 milliliter of the solution. I will double check my calculation, and it is still correct. I will need 1 milliliter of solution to give the correct medication for my patient. And then right before putting the solution into my needle, I will check again to make sure I have the correct amount, the correct type of medication also, and I still have the bacteriostatic, which is what is ordered, and 9 milligrams per milliliter. So I will be giving 1 milliliter of the solution. I will be keeping an aseptic technique throughout this process. I would wash my hands, and then I would clean the top of the vial because this is a multi-use vial. We want to make sure the top does not get contaminated and the needle does not get contaminated. So I would clean this for 15 seconds. Okay. And then I would put together my syringe and my needle. Carefully removing the cap. And be careful not to touch the needle to anything or lay it down at any time because that would contaminate the needle. It would no longer be aseptic. Okay, so because I need 1 milliliter of solution, I will draw up 1 milliliter of air, keeping it at eye level to make sure that I'm getting the correct amount. Okay, and then I would plunge it into the vial. And I would put that amount of air into the vial. And then turn it upside down, making sure my needle is still in the solution. And then draw up that amount, 1 milliliter, keeping it at eye level to make sure I have the correct amount, and making sure I have no bubbles. Okay, and then carefully remove the needle from the vial, and then recapping the needle so that I can bring the medication to the patient in the room. So right before I go into the patient's room, I would check the MAR again to make sure they are getting the correct medication. Jane Doe, 3/27/1989 is her birth date, is getting a bacteriostatic 9 milligrams intramuscularly at 11 o'clock. Okay, so I would go into the room and verify the patient with 2 patient identifiers, name and birth date. So I would ask, what is your name and birth date? And she would verify that her name is Jane Doe and that her birth date is March 27th, 1989. So I would then ask if she has any allergies and if she has any questions about the administration of this medication. I would let her know that we're doing it intramuscularly and that we will be giving it into her deltoid muscle. So to find the deltoid muscle, you would find the acromion process and then do it 3 to 4 fingers down. And you would make sure the arm that you're using is relaxed, that the muscles are not tensed or anything. And I would put on my gloves. And I would clean the area that I will be doing the injection to. So acromion process, 2 to 3 fingers down. I would clean that area to keep it clean. Okay. And then remove the cap of the needle carefully. And then with the bevel upwards and making sure I am putting it in the correct location, 3 fingers down from the acromion process, I would keep the skin taut and plunge the needle into the area. At this point, I would aspirate to make sure I'm not in a vessel. And no blood comes out, so then you can inject the fluid at 1 milliliter per 10 seconds. And you would hold it there for a few seconds to make sure all of the medication is being administered into the patient. And then remove the needle. And place a gauze pad or alcohol swab over the injection site and hold it there for a few seconds. And then I would not recap this needle. I would dispose of it into the sharps container. And give the patient a Band-Aid if needed, and document what I did. So I would document that I gave Jane Doe a bacteriostatic 9 milligrams, 1 milliliter, at the deltoid, and I would specify what deltoid. So I would say the left deltoid. And that's all. Thank you.